How to Survive Carpal Tunnel Syndrome. Hi, I'm Jason Barlow, RMT, and I'm here today as your therapist and coach to help you transform your stress, tension, and pain into health, happiness, and vitality. So welcome to today's podcast. Today, I'm focusing in on carpal tunnel syndrome. It can be painful. As a massage therapist for almost 18 years, this is something that I'm truly working to help prevent in my career as a therapist, because it's common to see therapists go out, believe it or not, after 7 years. That's the average for a massage therapist to leave the industry. And I feel a lot of that is to do with the fact of injury that occurs using our hands and wrists for most of our day if we're not taking care of our bodies and we're not doing things to protect and preserve the structural strength and integrity, especially of the wrist joint. So what is the carpal tunnel in particular? So if we were to look at the wrist, and we're looking from a palm perspective here, right in this section here, you have what is known as the transverse carpal ligament or retinaculum. The easiest way to understand it is it's a cable tie. And inside of your cable tie, there are 10 things passing through it. So let's just call them 10 cables that are passing through, 9 of which are the tendons of these muscles on the base of your arm or forearm. These are called the flexors because they flex your wrist. Any basketball athletes out there, every time you shoot the ball, you flex the wrist. That is the strong, powerful forearm flexors that are helping get that flick of the wrist. And as we described to our basketball athletes, putting that hand in the cookie jar to finish off the shot. So it's made up of 9 tendons and 1 nerve known as the median nerve. And that's the one that produces the carpal pain in particular, because it's usually numbness and tingling and radiating pain that happens into the hand and arm and thumb. And traditionally, the median nerve is basically covering all from the thumb to the index finger, middle finger, and halfway through the ring finger. And this can be on either hand, by the way. You have 2 carpal tunnels. Now, why is that actually happening? So traditionally, there are either one of two things happening, and very often a combination of the two thereafter, is either the tunnel itself is reduced in its size, or the contents, those 10 cables that are passing through, have actually increased in their size. So 2 possible causes there. Very often with true carpal tunnel syndrome, it's a combination of the two. The tunnel is reduced in size and the contents have increased in size, and it's just a double-edged sword that leads to obviously quite a lot of pain and discomfort. Remember, I've talked about this before, there are 2 origins of pain in the body. One is trauma. We slip, we bang, we fall, especially the wrists, right? If we fall forwards, what do? We tend to put the wrists or hands out ready to stop ourselves from taking a face plant to the ground. So trauma can be a trigger for carpal tunnel. Now, from my experience, that might be the straw that breaks the camel's back, but very often we all have this in the background, what I call the second cause of injuries, slow motion injury. That is due to the nature of our posture and how we function and live our life. We've accumulated what I talk about in my book, the 15-step playbook for pain relief, postural debt. We all are accumulating this every day. And unless we're taking the time each day to pay off some of that debt, it's just like a financial debt. It can just keep building to the point of which it overwhelms us. And in regards of overwhelm for us on a physical level with our wrists today that we're talking about, it will produce signs and symptoms and eventually pain at its very edge of tipping point, and even immobility. It will stop the muscles from working around the wrist and hand, because it's basically saying to you, you got to stop, because I'm at the point where I need to heal. You're not giving me the chance to heal. So I'm going to shut everything down in this area and force you to recover and heal. And we have to listen to these signs and symptoms. The earlier we listen to those signs and symptoms, the less likelihood there's going to be a chronic situation for carpal tunnel syndrome, and particularly to prevent the need for a needle. Who wants to go get surgery? I'm a huge advocate of preventing surgery in any way, shape, and form that we can, because as soon as we introduce a needle and we've got scar tissue introduced, and then we start to alter the structures and things are pulled and twisted, I'm just not a fan unless it's the last resort. I highly recommend to get certainly massage therapy performed, active release therapy, and any form of soft tissue release type of work, dry needling, shockwave therapy. These are all wonderful tools that a person can use. Now, if you've been trying some and they've not been working, there's a level of persistence that's important, but there also can come a point where you go, I cannot afford to continue doing that, or you're not seeing the results that you would expect. So maybe you have to try an alternative route. And there's lots of therapies to choose. Deep tissue massage is one of the most effective ones. That's what drew me to this industry. So either the contents within that carpal tunnel are increasing in size. Why does that happen? Traditionally, repetitive stress. What I'm doing here is the motion of using a mouse, right? We're typically using a mouse with our dominant arm, or at the same time, we'll be using a device now. Obviously, with our technology improvements, we have our portable computer in our palm that we take with us everywhere, and social media draws us in. So we're fairly constantly having something in our hand which demands the forearm flexors and puts excessive demand upon that carpal tunnel at the same time. So repetitive stress injury. The other one is edema, which is the swelling and inflammation that can be caused due to somebody who suffers with diabetes, hypothyroidism. Pregnancy is obviously another condition. I say condition, another scenario within which the joints can inflame due to the hormonal changes taking place in the female body, and rheumatoid arthritis. That's another inflammatory condition, and the wrists and fingers especially are quite the common area to experience that type of pain and symptom. Reducing the tunnel size, why does that happen? Again, it could be due to trauma, bony calluses that form around the tip of the radius bone, ganglia and cysts, and once again, that rheumatoid arthritis. So what I want you to take away from today's discussion here is that the reason why your carpal tunnel is developed, we got to understand the history there, because maybe you do go get surgery or you've had surgery. But if the causes remain the same, you continue to use your hand excessively with mouse work and you're not changing your ergonomics. Essentially there, what I'm saying is, for as long as you continue to accumulate postural debt, even though you've had it corrected with surgery and it temporarily helped, you're continuing to maintain the origin of the first type of pain. Your body's going to show up with something else. Maybe it'll migrate down to your elbow or into the shoulder, into the neck, or into the head. Your body is telling you all the time and giving you clues and cues to make changes. We've got to listen to it. So postural debt for me is the ultimate source of all pain and imbalances. And I have a 5-step solution that I'm going to share with you just now. I talk about this in my blog this week, so look out for that blog coming out. I've put the link to that blog in my description below. Also, with my piece that I'm sharing with you today, I've included a video down below in the description. Again, there is a link for a YouTube instructional video which teaches you how to stretch the forearm flexors and alleviate potentially that inflammation that's arising due to 9 of those cables, 9 tendons, 9 muscles that are traveling through the carpal tunnel and only 1 nerve. There's 9 times more chance that it's going to be those that are causing your issue than it is the nerve itself. So my 5-step solution, you see it scrolling across the screen if you're watching the video here. The 5 steps are: 1, to move; 2, massage; 3, mobilize; number 4, stretch; and number 5, exercise. So very briefly, I'll just say, you've got to move the body. As soon as you move, especially the joints, you stimulate something known as synovial fluid that lubricates the joints. It generates some stimulation to the nerve. It creates a change in your blood delivery to this area, and it starts to generate and promote heat to that region. The next step is to massage. Well, how do you massage this area? Well, you got to come back and check out some of my other videos, don't you? But in essence, you could just take your own hand, the opposite hand, or get somebody else to do this for you, right? Or you can put a tool in your hand and just massage all around the palm, but particularly focus through here, the bulk of the muscles. You can stroke through the tendons and near the carpal tunnel, but if it's overly inflamed and painful, you're probably going to be better to invest your time down into the forearm muscles here, the forearm flexors, remember? The next step would be to mobilize. Again, it's another level of movement, right? So it's to extend the joints in all possible ranges of motion and just stimulate that blood flow and get the synovial fluid stimulated. But it's also actioning what we call the lymphatic system. The lymphatic system is actually going to help reduce the edema, any swelling that you have going on. There's actually dry brushing techniques that you can use to assist in reducing that. Again, it's a massage method that's helping to stimulate the muscle and the lymphatic system to help reduce that inflammation. The focus today, though, is stretch. I'm teaching you how to stretch the forearm flexors. Very simple, very easy to do. You got to go check out the YouTube video. I'm not going to get into that in this particular piece right now, but I am going to say this. Why do you need to stretch? Very simply, because you're overusing those muscles. That's it. And when you overuse a muscle, traditionally, it becomes hypotonic. I beg your pardon. It becomes hypertonic. It gets shorter and tighter. That's hypertonic. Muscles that are longer or weaker are what we call as hypotonic. So you might think, well, I see lots of animals, they don't stretch. And I've heard that debate and argument come up on some forums before as well. Yes, I agree. Sometimes you'll see certain animals do certain things to, I don't know what they're doing exactly, and I don't know if they even know what they're doing. But my argument, my counter argument to is they don't stretch, but they go off and run and chase down an animal, is they've not spent many hours on devices, using the mouse, on their keypads, and using the phones, and sitting in that posture that we're all generally adopting, that fetal type position. And so for me, from my experience as a clinician, we have to stretch the muscles that are short and tight. We don't need to stretch the muscles that are long and weak, bottom line. What we need to do with the long and weak is the last step, number 5, which is to exercise them. And so by exercising those muscles that are long and weak, we can bring more balance back to the joints and help improve and recover and heal, especially from something like carpal tunnel syndrome. Thank you for joining me today. I really appreciate you joining me if you came on live. Go to my website, jasonbarlowrmt.com. From there, you can actually download my book for free. Why not go and do that? Just leave me your email. I'll send it to your inbox. You can put it on your device, which obviously you're going to very conscientiously now limit the amount of time you're on there. So just read half a page a day or a page a day of my book and then put your phone down. Garnish yourself with that information. I get into lots of great things that are going to help change your stress, tension, and pain. You can also get a paperback edition from Amazon. Just look up the 15-step playbook for pain relief. From there, you can also get a Kindle edition too. Remember, your muscle health is my #1 priority. Thanks for joining me, and we'll see you again on Thursday.